Hello there. This video is only for the students who purchased my course, whether it's the OSCE Formula or the OSCE University or the Mastermind. So please don't share it with other people. If you are listening this by any chance, then probably you're very lucky because this is a video I'm doing only for my paid students. Um, the reason I'm doing this video is I've noticed that over the past few days, to pass a clinical exam, it's not only the knowledge, there are a few other things which I will be talking in the next few videos. So these are very, very important. People have knowledge, but it's the mindset. So I thought I will do some videos about the mindset, how I felt when I was preparing for my clinical exam. And that's the only reason I actually want to do this video so that you guys will benefit from it. Okay, so the first scenario in my exam, I had to take the exam in Sydney. I flew all the way from India because before my exam, I was married 15 days before my exam, so I was in India. I think my exam was on the 27th of August and my marriage was on 15th of August. So I flew all the way from India directly to Sydney. I was in Hobart as a resident medical officer with my wife. So it's a stressful moment. It was very stressful for me, but still, I thought I can do this exam. All my friends said either postpone the marriage or postpone the exam, but I said no, I'm doing both. So that's the story, the background story. The day before the exam, my dad had an MI. He had an MI when he was doing the treadmill test. So I thought, man, I was panicking. He was in ICU. They have done emergency stenting. He had massive MI when he was on the treadmill. So he was in the hospital the day before my exam, which is 26th of August. And people were calling me all day night. In the middle of night, I used to get calls saying, "Oh, dad is discharged." My brother, he was a very young fellow. He's 5 years younger than me. He was panicking. He didn't know what to do. My uncles were calling me because I was the one who was taking decisions on what next. Because initially he was a bit unwell. They were thinking, should they do a surgery or not? But his ejection fraction was low. So they were not sure if we do a surgery, he might die on the table. So I was dealing with all these things. I had my new wife. I was newly married. My wife was with me. Um, and it was under a lot of pressure. I almost gave up. I thought, man, I think I will fail this exam. I must not have done this. Um, but one thing I told myself is, okay, so I paid my exam fees. It was about, I think about $3,700 or something like that. I don't remember it exactly. It was a few years ago, 2010. So I paid my exam fee. So I thought, man, at least I will go to the exam. I will see how this exam is. At that time, people were telling that 40% of people pass and 60% fail. So I thought, at least if I go there, I will listen to all the scenarios. I will, get some idea about, how the exam is. I will feel the exam. I will see how the examiners are. I've done three mock exams before that, but I didn't appear in a real exam. So I thought I paid money. I don't want to say I'm not going to the exam. I'll just go there. I will at least have a feel so in the next exam I can do well. I had zero chances that I will pass the exam because I didn't sleep almost all night. Um, my wife, she's an asthmatic. I didn't know that till I first came to Australia. Means she never used a puffer or anything. But when we landed in Australia, she said, I can't breathe properly because it was peak winter that time in Sydney and it was extremely cold. I don't know if any one of you lived in Sydney or not. It will be horribly cold. So lot of things were going through my mind. Is it pulmonary embolism because we recently flew from India? Does she have a clot in her lungs, or you know, is it asthma or is it something else which I don't know? Is it something which she picked up in the flight? You're preparing for your clinical exam, so your differentials are going through the mind. So lot of pressure. So I couldn't sleep properly, and 6:30 in the morning I woke up. I was living at a friend's place. Then I went in a train. All I did in the train was I just sat down. I thought, okay, I will just recall what all I've done, what is my strategy, the formula, the step by step guide. What do I do when I stand in front of the door? What do I do when I see the scenario? What do I do when I go in? Who will be there? What should I tell? So, all I was thinking is nothing but what is the exam strategy. I never thought what will happen to my dad. I never thought what will happen to my wife. I said, no, I'm going for this exam. I want to give 100%. So I was thinking about my strategies. The main reason I think I passed all 16 stations is I had strategy. That's the key. You should have that strategy, you should have the approach. So the mindset, I believed in myself. Although I gave up, I had a hope that hopefully I will pass. So I went with this mindset that what is the worst thing that will happen? I will fail. That's fine. I will take the exam again. I was not worried too much because I didn't sleep at all. I was in Sydney and my wife was unwell. So all these things were going in mind, but I was simply um, you know uh, looking back at my structure, the strategy, and um, the station came. The funny thing is, I was feeling very sleepy because obviously I didn't sleep. I think three times I got a call in the middle of night. So I went to the station, to the exam hospital. There was a good Bangladeshi driver, in the taxi, and I was having a chat with him. He was asking me, how much money you make, why are you going, what are you doing on Sunday in the hospital. We had a good chat, so I did not have any pressure at all. He was a nice guy, so I thought, man, hopefully it'll all go well. And I was telling him what all happened, and I didn't think about my strategy. I just, relaxed in that trip. It took, I think, 20 minutes. Um, because I was only able to catch a train till certain place in Sydney, and from there I had to go in taxi or I can go in a bus. But I thought bus was waste of time, so I just went in a cab, and I was talking to this guy, and I was very relaxed because he was a very nice guy. I think he was an accountant back in Bangladesh, and he was driving taxi, and he was telling his problems, and it was fun. It was fun. I enjoyed the trip. He was a nice guy. So I went to the exam place and my mind was not working. I felt like heaviness on the head. I thought, man, if I go like this, I'll probably screw the exam. Then I thought, there was a coffee shop there. So I had a coffee. I bought a Red Bull, a big one, a big Red Bull, and I just had both of them. And after 15 minutes, I was feeling like a bull. So I was very energetic. I was because caffeine kicked in, all the stimulants and Red Bull kicked in, and in 10 minutes I think they called me in, and I sat down there, and this is the first thing I told myself that I'm not looking it as an exam which has 16 stations. I told myself I will only look at it as one station at a time. Okay, there's a small story behind this. Um, there, for someone who will follow cricket, I think this will make sense. Otherwise, it will not make sense. One day, two great Indian players, chased a massive score. Something which never happened in history before. So this guy was interviewing these two people. They said, "Look, how did you guys do this? Everyone on this planet, thought you will lose the game, but how did you guys pass? Not pass. Win the game." Then both of them told one thing, and this was very helpful to me. And I hope this will be helpful to you as well. They said, "We never looked like we had to bat for 2 days. All we told each other is we will finish 1 over at a time. 1 over in cricket has 6 balls. So all we said is, let's finish this over. After this over, we will plan the next over. Forget about what is happening, what will be the outcome of the game. So that was very helpful to me. I told myself, okay, I am not looking it as a 16 station exam. I am only looking it as a one station at a time. I told myself, I don't care what happens to 15 stations. I will only look at the first station. Okay, so that's the only thing I was thinking. I will only look at this first station. I don't care what happens to the next 15. Then once I finish the first station, I thought I will only worry about the second station. I don't care what happens with the first one, and I don't care what happens with the other 14 stations. So that was very helpful for me. So I was standing in front of the room, the first station. I knew that I will be panicking. Okay, I think you will panic as well. Although you have taken the exam before, or you have done a lot of mock exams, when you stand in front of the first station scenario, trust me, you will shiver. You will have fear. Okay, so I knew that this will happen before. So I told myself, okay, when I stand in front of the door, in front, in where I'm reading the scenario, I will have fear. Okay, any human being will have fear unless you are a computer or you are a robot. So I told myself I will have fear, so I should stick to my plan. Okay, I had a plan. What is the plan? It's my ABCDE approach. Okay, when you are under pressure, you have to tell yourself, that this will happen, that you will have fear, and now you will stick to your ABCDE approach, okay, which is what I teach you in the course. So I did exactly that. So I went there, I stood in front of the door, the bell rang, and that's it. I started getting fear. Then I told myself, okay, you know that you will have fear, but you have to stick to your approach. If you are scared, you will screw the first station, then you will screw the second, then you will screw everything, and you will fail the exam. So I told myself, and I started talking to myself, and I said, look, yes, you have fear, but that's okay. You have to just stick to your ABCDE approach. Then that's what I did. If you go back to the first two videos in the course, you will see the ABCDE approach, action words, blunders, um, you know, common diagnosis, direction, and entering the door by knocking with a smile on your face. Okay, so I told myself, okay, what are the action words in this scenario? That first scenario was, I think it was like a 58-year-old male who has come to you passing blood in urine. It was actually a very easy scenario, but because I was under pressure, I was panicking. I thought, man, okay, so that's fine. I have pressure. That's okay. Action words. 56-year-old male John has come to my general practice and with blood in urine. Okay, action words. Ding, 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 ding. So I had everything. Then B is what will kill this patient with the symptoms. So I had my differentials, common diagnosis, then my differential direction. Then I entered the room with a smile. Once I did that, that's it. The fear was gone. And I think I went as per my approach, the 3-step formula later, then the 5-step formula, then my traffic light approach. Um, for those who purchased my basic courses, you will not know what the traffic light approach, because it's a advanced strategy I only teach in the OSCE Mastermind course. Then I use my traffic light approach. So traffic light approach is something you use when you don't have much time in your clinical exam. Okay, when you use this one, when you don't have much time, you're under pressure, you smash it. That's it. That's very powerful approach which I've discovered. This is something, I thought, man, how can I finish a station in 2 minutes, not 8 minutes, 2 minutes? And that's when, I figured out this traffic light approach. Um, so I used the traffic light approach, then my consent, then, ill or well, I went as per my step by step guide, and that's it. I finished my station. Then I got confidence, and The examiner was a nice guy. He knew that probably I'm from Indian subcontinent, and he could see I was shivering. I was literally shivering in the exam station. He was very nice, I think I said I will do a CT scan. He said, "Oh, will you do something simple? Will you do something simpler than a CT scan for this patient?" I said, "I will do an ultrasound abdomen." And he said, very good, very good. He was encouraging me. He was a very nice guy. You get some good examiners, sometimes you get some grumpy examiners, but some people are very nice. He was encouraging me. Everything I say, when I say I will check if he's on any warfarin or aspirin or any blood thinners. He said, very good. So that gave me more motivation. Once I finished that first station, I knew that I will smash this exam, because although my mind was crap, I was under the influence of caffeine, not alcohol, influence of caffeine, and I believed in myself. That's when I told myself, that's it. I am smashing this exam. I don't care what happens. I will just stick to the same formula, stand in front of the next door, ABCD approach, enter the door, enter the room with a smile, three-step formula, five-step formula, traffic light approach, then examination, then, the artist approach where, I draw diagrams and things like that, and smash it. So every station I was smashing in 5 to 6 minutes, except one station. I think that was Fever of Unknown Origin. Many people said, man, I struggled in this station. They said, oh, it's a recall. I didn't know that it's a recall, because I only read, I think, 1 or 1.5 year recalls, and this was there few years ago. Till my friend said that, I didn't know that it was a recall. Um, but I had some AMC book cases, so that gave me more confidence that I will pass. And I think when I was in my 13th station, I knew that I'm going to pass this exam. I was extremely confident. I was not overconfident, because I knew it. I knew what was happening. I finished my station, and some examiners, I think 2 or 3 examiners, they were extremely happy. And they even showed me the result, clear pass. At that time, it used to be clear pass, clear fail, unsatisfactory, something like that. So they showed me the result, clear pass. And all these minor things were giving me confidence. Then I thought, 13 stations, I think I passed the exam, but I have to smash the next 3 stations. And that's it. I went there, smashed all the exams, came outside, and someone asked me, will you pass? I said, yes, I will pass 15 stations. I don't know about one station, the back pain station. The examiner was a bit grumpy. I think he might fail me. But the funny thing is, even the grumpy examiner passed me. I passed all my 16 stations in my first attempt. You know, was in India. I was not studying much. Indian marriages, that they are massive. Lots of families and busy. I had to go to people's places, all relatives' places after the marriage. My dad having an MI. But the reason I'm telling all these things is, you should believe in yourself, have a strategy, have an approach. Please practice. I've done lots of practice. That's why all these things were easy. I'm not saying, if you don't read, if you go there, you will pass. No, I practiced a lot before. I've done lots of role plays. I use this approach, I use these strategies, and that's when I smashed the exam. Saying this, I'm finishing this. I will do a video about the mindset before the second scenario. That's also very useful one. You will love it. I hope you loved this. Sorry if my story was a bit boring. I just want to inspire you guys. A lot of people fail because they have bad mindset. Okay, it's all about the mindset. So work hard, do lots of role plays. You will smash the exam. I wish you all the best, and I will see you in the next video. Please don't share this with anyone, because this is only for the students who paid for my courses. I wish you all the best. I hope you're killing your exam. Smash the exam. Tell yourself, smash the exam. Anytime you're low, tell yourself, smash the exam, and you will pass. All the best. See you later.